Uh, Given your vast experience in implementing field research and development programs in various Asian countries, how do you think policy innovation and digital access initiatives have contributed to overcoming barriers in healthcare delivery for elderly? And what emerging trends do you see in this space? Do you think it's coming more from the public healthcare system? Do you think it's coming more from the private sector? Where do you think Asia is heading when it comes to digital therapeutics? So you're on mute.
Sorry. Thank you very much for giving me an opportunity to share my views in the area of digitalizations, AI, and then the health sectors. This is very, very important topics. I think congratulations to you all for taking on this initiative to launch these discussions, and also for the research that you actually have done on digitalizations and the health. If you like, as you have highlighted, and Paula and Deep have highlighted, that elderly people are increasing across Asia and across the world. You can see that number of elderly people are increasing, and then you have lesser people on lower pyramids. So the elderly, it's becoming more and more expensive to provide care to elderly. But the innovations that's happening around in AI and digitalizations is actually like it's a great revolution that's happening. It's a tool that has been put on the table. So these digital innovations and AI that's going to come is actually going to shift the entire healthcare systems, and I think we'll see more and more use of digitalizations and AIs in healthcare system. But one of the things that you see, like the entire countries is not saying that. If you look at Asia, some are poor, some are rich. The affordability, accessibility. There are lots of factors actually that you know act as a barrier to adoptions of this technology. It's expensive. In the rural areas, the infrastructures are poor, and also you can see that the digital literacy is very, very low. So it's really a big challenge. That's where I think the policy innovations, the private public sector partnership actually could actually come in and play a very important role, so that it helps us in lowering the barrier to access this the opportunity that digitalizations and AI is bringing. So of course, I mean, like, government has to play a very important role, particularly in countries like India and other poor developing countries, and even like countries like Japan, Korea, Singapore. They also, like, there are people who are in the lower income quartiles who have difficulty in accessing this scheme. So therefore, like, government of Japan and Korea have already launch reimbursement of digital healthcare services under public insurance. So that's a big move to promote digital healthcare. And you know that in India also, government has led lots of telehealth platforms like e-Sanjeevanis, and China has also been very pioneer in terms of China's health plus internet, internet plus health. So that actually, like, as a result, like of this, that, like, we are able to provide healthcare service at the doorstep of the elderly, instead of like them coming to access the health. So you can see lots of innovations happening. To give you an example, in Bangladesh also, like, the digital healthcare has expanded so much. You can sit anywhere, and within a minute of 3 minutes, waiting time, you can access doctor in Dhaka, and you can and then the doctor in Dhaka can assign the nearest supplier to drop the medicine to your place. Even the in India also, we have seen, like, because of digitalization, how you can actually get the people to come and collect samples in the house, because you are able to access technology, use, and then set up appointments. So there has been so much of transformations, and I think those transformations that you see in Asia that's happening, it's all led by the government acts as a catalyst, and the private sectors actually jump in to take the opportunities. And at the other hand, elderlies are also benefiting because that's if you look at Indian settings or any South Asian setting, it was all mostly family-driven caregiving, elderly caregiving. But with small nuclear families, children moving out, it's very difficult to provide family-based elderly care system. That's where I think the digitalization, the AI therapeutics has actually come in and help ease the problems, and also for the children, they are able to rely on this digital care system to take care of the elderly parents. So humongous amounts of, I think, innovations. The government of India, government of China, and all these developing countries have actually moved. And I think from my perspective, you'll see more innovations, more happening in this area. And I think this is going to be the norm in future. Thank you.
Thank you so much, Dr. Rahul.